we want to ensure that the great work of the Global Fund and all our other partners have contributed over the years in helping us fight malaria will not be reversed in the coming years. We need to ensure that we protect the architecture, the infrastructure that we have developed for malaria, even as we fight future pandemics. And this is one of the issues I'll be engaging Donald Kaberuka and the rest of you as we continue working towards future replenishment. That look, let us not forget this fight. Let's get our partners to understand that it is in the interest of everybody that we keep our eye on the ball. The fight against malaria, the fight against TB, the fight against HIV/AIDS. These are all critical fights that will ensure that we are better placed not only to fight the current pandemic that is keeping people's attention, but also help us prepare to protect ourselves against future pandemics. The need to continue to focus on ALMA's key agendas, which I think we really laid out last time, and which I would like to repeat once again. And these really are a 4-point agenda that focuses first and foremost on digitization and the use of real-time data, including sharing of country malaria scorecards, which can also be used to support us in our fight against current and also future pandemics. And in fact, we did launch our own ALMA scorecard hub, and this was part of our agenda during my 2-year tenure. And this real-time data gives us greater transparency, accountability, but also helps in evidence-based decision-making. This card has been used by countries to publish their scorecards. We now have 10 countries that are already sharing their scorecards through this site, and that's Kenya, Rwanda, Ghana, Burkina Faso, Eswatini, Zambia, Burundi, Mozambique, and Malawi. And many are documenting best practices not only to fight malaria, but also to establish ground rules for fighting future pandemics as well. And this is something, with your support, I would like to urge, as President Kikwete just said, ownership of these kind of scorecards by individual countries with the support of organizations such as yourselves. And then the other point, which I'm really happy to hear everybody mention, is the launching of the ALMA Youth Army. These are the grassroots leaders who are the workforce and the bulk at the grassroots level. These are the social health care workers. These are the young men and women at the grassroots who are engaged, whom we need to resource. And this that we call our ALMA Youth Army is what is going to be our best defense, not only in the battle against malaria, but again, I wish to reiterate, help us create a cadre that will also help Africa fight future pandemics as well. And I've heard many speakers refer to that, and that is something that we would really encourage a lot of you to support our ALMA Youth strategy, because this, I believe, is what will really enable us to get to the grassroots level, touch the majority of our people, not only in our fight against this particular pandemic of malaria, but also in our fight against future pandemics. And in this regard, we have engaged a great number of youth. And we have, as a result of COVID, as a result of lockdown, as a result of people losing jobs, we have also, let me say as Kenya, taken advantage of the COVID pandemic to re-engage our young people into this particular project through what we call our Kazi Mtaani program, which is engaging young men in cleaning neighborhoods, in helping in health-related aspects in their respective communities, And again, we have seen as a result of this, it has also had an added effect of helping us reduce waterborne diseases, helping us in our fight against diarrhea, bilharzia, etc. But this is something, again, I believe national governments require international development support to be able to continue in this fight. Because it's not just a fight about malaria, but as we are dealing with malaria, as we are dealing with COVID, we're also dealing with other health-related issues by engaging these young people that we have across our countries.
In terms of how to deal with malaria vis-a-vis.
We need a larger and capacitated health.
The time, everyone, and thank you.
Thank you very much.
I think one of the concerns I have is that
community health workers, which we surveillance assets at the local level, and even
challenging place from a resource mobilization perspective. In answer to that, I'm absolutely convinced that if you want to build better disease surveillance, better ability to deliver diagnostics.
Is there a rise in any respiratory disease or fever type diseases